Cancer has devastated the lives of many across the world and continues to kill millions each year. Cervical cancer is no different, except it's preventable. It ranks the fourth most common gynecological cancer across the globe, and it's the third most common cause of death among women living in low-resource countries. Across the world, cervical cancer is a disease of disparity. Health disparities can be described as the difference between the prevalence, incidence, mortality, and the burden of disease among specific groups of people. These groups may include different races or ethnicities, ages, socioeconomic classes, gender, and level of education. Risk factors may include the environment, biology from birth, personal behaviors, sociocultural behaviors, and one of the most compelling factors is poverty. It's a tragic fact that women all over the world are dying from a preventable cancer, and the statistics are staggering. Women who identify as non-white Hispanic or African American are more likely to be diagnosed or die from cervical cancer when compared with white women. According to the World Health Organization, 570,000 new cases of cervical cancer were reported in 2016. United States cervical cancer disparity statistics reported by the American Society of Clinical Oncology estimate that 13,170 new cases of cervical cancer will be diagnosed this year alone, and that 4,250 deaths will occur. The incidence of cervical cancer per 100,000 women based on race or ethnicity are as follows. The 5-year survival rate for all women with cervical cancer is 66%. For white women, the 5-year survival rate is 69%. For black women, the rate is only 56%. That's a 13% difference. This needs to change. Did you know that cervical cancer is actually caused by a virus called the human papillomavirus, or HPV for short? HPV is considered the most common sexually transmitted infection in the world and is the most causative factor in 99.7% of cervical carcinogens. HPV types 16 and 18 are found in 70% of the cases of cervical and anogenital cancers. Primary prevention of HPV is now possible with the HPV vaccine. This vaccine should be administered to all male and female adolescents. The administration of this vaccine is key and may very well eliminate cervical cancer in the future. Despite the advancements in cervical cancer screening methods, treatment, and the implementation of the HPV vaccine, minorities continue to have a higher associated risk factor and experience higher mortality rates. Cervical cancer is very preventable and needs to be addressed at the community level. In order to combat cervical cancer incidences among minority populations, we must identify barriers to prevention and then identify women who are at risk and provide them with preventative education. Screening and early treatment is currently the gold standard recommendation for secondary prevention of cervical cancer. According to the United States Preventative Services Task Force, women should begin screening at age 21. Below are the recommended guidelines. In order to prevent future unnecessary deaths of women and target minority groups simultaneously, we must provide culturally competent care through community-based programs. Every woman should receive information handouts about general health, condom use, cancer awareness, when to have a pap smear, HPV prevention, and HPV vaccination recommendations. Encourage women to share this information with every woman they know. Knowledge is power. Together we can save millions of lives. Promote vaccinations. Educate your patients. Ensure patients receive appropriate screenings. And most of all, remember, cervical cancer is preventable.